Have you ever wondered why your doctor isn't using the latest technologies and treatments to provide the best possible care to you and your loved ones? This is Dr. Juan Espinoza, and he's a pediatrician at the Children's Hospital of Los Angeles. And every single day, he's responsible for treating these kids. Juan is extremely passionate about using the latest technologies to provide them with care, and he does this through research. Juan is currently conducting a clinical trial to gather activity data and survey responses from his participants to understand why some of them aren't losing weight. Unfortunately, this is the mess he has to deal with. Countless CSV files, messy database structures, paper surveys. He even logs into each of his patients' Fitbit accounts every week and writes down different values. That's not only time consuming, but it's error prone, and you can imagine the headache of trying to do this for 10 people. Imagine doing this for 100 people, or even 1,000 people. It's just not feasible, and that's why we built HexCare, to support the data management process for clinical research. This is our patient-facing app. It can gather data from blood pressure monitors, scales, activity monitors, sleep trackers, but it can also gather contextual data, like symptoms or medication use, survey responses. Now, all Juan has to do is invite all of his patients to download our app, and all of that data is wirelessly sent to our HIPAA-compliant infrastructure, where he can analyze it, visualize it, and access it wherever he is. But Juan is not alone in doing this type of research. Over $50 billion a year is spent on clinical trials, and out of that, $2.5 billion is spent just on data management. We position ourselves to support behavioral trials, which is the type of research that Juan is doing. To use our service, we charge about $25,000 per trial. This accounts for the number of participants, the length of the trial, and any customizations that are needed. And on average, we save researchers over 50% of their budget on data management, allowing them to allocate that to more important parts of their research. So over the past year, we've been spending a lot of time on the ground floor with researchers to understand their pain points and how we can build different solutions. And I'm excited to share with you that since January 2016, we've generated over $30,000 in revenue and have a $62,000 contract under final review at USC. Based on our current growth, we're projected to support over 30 trials by the end of next year, netting over $750,000 in revenue. But we're not going to stop there. The next step for us is to support pharmaceutical drug trials. Now these trials, on average, there's over $1 billion spent on a new drug, and there's over 200% more of these trials than behavioral trials. In the future, we're planning to use all of this extremely valuable data we're gathering to develop other solutions that can improve patient health. So how are we going to do this? So in healthcare, trust is critical. So we plan to train a sales team to go across the nation and earn researchers' business and earn their trust. Also, we plan to attend key events across the country to network with thought leaders and even influence the direction of this market. And also, researchers like Juan, when they're finished with their study, they often publish their research so other people can read it. When they see that HexCare was able to streamline that process and save them money, we can grow that way as well. So we do have some competition in the space. However, we're the only solution that gathers all of the data points a researcher cares about in one location, where they can conduct fast, cheap, and effective research. Also, we're first to market at most of the major medical centers in Los Angeles. We built strategic partners with leading device manufacturers, and we spend a lot of time perfecting our design and brand to build trust and credibility in the healthcare space. This is our team. So we have a lot of technical expertise, but we've also surrounded ourselves with clinical experts to make sure that we're building solutions in healthcare that are solving actual problems. So I want to stress to you the importance of research. By conducting studies and scientifically proving that new technologies and treatments can be used in a clinical setting, Juan and other doctors around the world can improve and save lives. And we're excited and passionate about supporting and streamlining that process. Thank you.
Judges, questions?
Great job, thank you.
Thank you.
Can you just walk me a little bit through about what a behavioral trial is and what data you're actually capturing and what is actually being streamlined?
Sure, so behavioral trials are testing usually new treatments or new interventions. So Juan specifically, for his study, he's gathering Fitbit data, gather activity, and he's gathering survey responses, and he's bringing them in every week and trying new intervention techniques with the patients and seeing how that changes over time. So that's kind of an example of behavioral trial, but in more detail, there's a lot of devices coming out that are gathering valuable data. So we've incorporated all this as well as the contextual data.
In terms of the pricing, how do you balance platform fee versus customization, services, integrations, and that?
Sure, so baseline, we typically factor in about $10 per patient per month. That's kind of the baseline, and then customizations include maybe adding extra data visualization capabilities for a researcher, or adding different components to an app. But typically what we realize is there's not a lot of customization. We want to build this, make it modular enough to stand on its own. That way there's not a lot of work we have to do when scaling it.
Lloyd, I know you have a question.
Yeah, you can see my brow furrowing. I read this and I listened to that, and I'm still not getting it in terms of what it is that your device is doing. That's going to make it adaptable to all these different research trials, and how you're going to reach your market.
Sure.
There's two questions, but go for it.
Okay, so yeah, the very core of what we have is an app, just for
That I got. I
And
saw
then-
the app and how it applied to one. I didn't see how it applied to everything else that you're talking about doing here.
Sure. So there's tons of different studies people might want to test. So for example, if a pharmaceutical company has a new blood pressure drug, they can very easily go to a doctor and say, hey, can you test it with 100 of your patients? They would come to us and say, hey, I want to gather blood pressure trends over time. I want to know when they're taking medications, and I want to know what symptoms they're having. So that's one example of a research study that's already possible with what we've built. To go to market, we've thought of a few ways, but based on our current traction, it's been more about building personal relationships. And the cycle for that is essentially a couple of months. We build the initial relationship, build the trust. They'll often talk to other researchers we've worked with to see if we're credible, and then they get institutional approval, and at that point we're good to go.
Now I'm going to ask you a question just to follow up on yours to make sure I'm understanding. So you sell a platform to someone that's conducting a clinical trial to allow them to more efficiently aggregate data from different places that helps them understand outcomes, right?
Exactly.
And are you tracking the interventions as well that clinician is implementing as well? Is that part of the
So-
platform?
Typically, no. They'll have their own study design process, and we're currently just focusing more on the data and streamlining that process.
Are you taking the data and combining it to provide insights as well? Is that part of it? Or is it really just aggregating the information in one place?
Mostly aggregating currently. Long term, we do want to develop algorithms using a lot of this data. Another kind of component is the medical record integration. So for a lot of researchers, they're already at hospitals, and they might want to use lab tests and correlate that with this patient-generated data. So at USC specifically, we partner with one of the startups here to integrate with their medical records and send all this data back to the researchers so they can correlate that themselves.
Other questions, judges?
So you're saying that none of these other competitors have medical record integration,
Correct.
and they're not working on it? That seems like a huge oversight.
Yeah, I think we got, honestly, with USC specifically, I think having the relationship here and starting in LA, we've been able to build that. Aside from that, it is going to be a difficult process scaling that because medical records are implemented differently across different centers. But researchers still want to use our platform without the medical records, but it's just kind of an added benefit.
So self-reported data is sometimes not considered very kosher for FDA clinical studies. So
Sure.
what's the kind of subset of the total market that can be addressed by self-reported data?
Great question. So a lot of researchers we've been talking to, researchers always want to innovate and use the latest technologies, and that's kind of where we're positioning ourselves to support those researchers that are using these new technologies. I don't have an exact number for the percentage of people using all these biosensors and so on, but it's definitely a hot area, and people really want to be forward thinking and drive this forward.
Other questions? Okay.
Do you see behavior around like how often repeat users are, or like doctor or a scientist, are they doing trials once a year, 5 times a year?
Yeah, so a typical researcher would do at least one trial per year or one study. And that's good for us because if we can get a $25,000 sale and we build that trust with them and they really like our service, that could turn into a $500,000 sale, over their career.
And you said your pricing is designed to be, if you're coming in effectively about a 50% discount, you're saying. You're saying that the average cost would be $50,000, not $25,000. Is that what I understood you to say?
Exactly. So this is the current amount spent across all behavioral trials. And, assuming the total market share for us would be 175, so that's over half that we would save them.
Other questions? Let's give it up for HexCare!
I want to aggregate data so badly right now.